I'm going to wait one more minute. It is 5:30 and we do have a quorum, but let's see who else joins us in the next minute.
Yeah, I haven't heard from anyone that they weren't able to attend, and
Okay, and
there's
nor have
Bonnie.
I. It's Bonnie.
I just don't have time to look.
Hello, everyone. Can you hear me?
Yes, we can, Bill. Thank you. Well, it's 5:32. I'm going to go ahead and call the meeting to order. Welcome to the Health and Human Services Board for November 19th, 2020. Welcome to the members of the public who are joining us on our county live feed. We have not received any requests to provide public comment. I will go ahead quickly and call the roll. Bonnie Barker.
Here.
Larry Bjork.
Yes, here.
Jody Cromrie.
Here.
Sarah Kennedy.
Here.
Bill Lamb.
Here.
Sarah Schaefer. She's not here. Gary Steen.
Here.
And Chairman Bartlett.
Here.
Okay. I would like a motion to approve the minutes from our October 22nd meeting.
I so move.
Supervisor Steen, is there a second?
No.
Supervisor Cromrie, thank you. Any additions or corrections? Additions or corrections? All in favor?
Aye.
Aye. The minutes.
Aye.
The minutes from October 22nd are approved. We've had a request from Veteran Services Officer Greg Quinn to go ahead, so we'll save the meeting discussion until after his report. Greg, are you still with us?
He is still away right now.
He is still away. All right, well, then we will have the discussion about whether we want to or need to have a meeting in December. If we did, it would be the 17th of December because the fourth Thursday we're conflicting with holidays here is Christmas. I guess I'll first ask the staff, Chris and KT, whether you think it's important for us, whether there's business for us to transact in December. Not sure.
I'm not sure. We're still waiting on some information about funding, but I think that we have everything that we need, but it's always a guess as to what's going to come down from the feds, unfortunately.
Right. Okay. Yeah. Chris?
I can't think of anything that is of critical need for December. And I would just offer KT that even if it is additional funding, we'll have to figure out how to do it behind the scenes anyway, because I don't mean that like it hinted away, but we'll have to figure out how to make it work within the system. Because we can't do a budget adjustment through the process before the end of the year. So.
Right.
Supervisor
Supervisor Bjork.
I'm fine with however they decide to go. It's just that we're living in kind of an extraordinary time. And if there was be anything that we ought to know from the health department, I'd like to, know about it and meet, but whatever, is fine with me.
Yeah, what I was going to do was ask who is available should we choose to meet on December 17th. Bonnie Barker, Jody, Gary, Sarah Kennedy, are you?
Yeah, I can be here, but we don't need to have it just because I can be.
Okay, Bill?
I can if need be, yes.
Okay. Well, let's assume that we aren't going to meet in December, that there isn't pressing business, but in the event that something comes up, just hold that date and we'll let you know in the next, hopefully, couple of weeks. Yeah, is that okay? All right. Now, Veteran Service Report. Let's see if we have Greg or if he is meeting with a client. Yep, he's not with us. Okay. Let's move on then to the Department of Public Health Staff Report, KT.
So just before the meeting, I did send out a situational report that was compiled today by about 2 o'clock using state data. So it is the most updated state data. And you'll remember that they do their data cutoff at 9 o'clock the night before, and then they process that, clean that, and then that's what goes into the state data. So in between 2 o'clock and 5 o'clock, we had an additional 2 deaths notified through the medical examiner's office. And so that brings us to a total of 8. I'm sorry, 7, no, 8. Wow,
8.
It has been that day. Counting is tricky. 8 deaths here in Dunn County. We are also watching for another death that happened today. It was, they were swabbed post-mortem. The ME believes that it may be COVID related. So that was sent off to the state for analysis. But of course, without that positive swab, we would not identify that as a COVID death, even though they had symptoms consistent with COVID when they passed. So with that really challenging kind of tone setter, what I wanted to walk you through just a couple things that I think are of incredible importance right now. If I could share my screen, I'll start with some of the state data and then pop in between that and our local situation report that I provided for you. All right, so this is the summary statistics, and I wanted to show you just where we are as a state and show you percent positivity because that data metric has been modified just slightly, I think in a better way. The trends are still nearly parallel or identical, but the percentage is different. And so we used to look at percent positivity by the percent of people testing positive over the percent of people testing negative. So new people positive, new people negative. But as we have tested more and more people, that is a less reliable or less accurate and precise measure. So now they are looking at percent positivity by test, total tests. And so you can see that the trends really mirror each other, but it is a lower percent positivity. And so I wanted you guys to be able to hold that kind of in your brain as you look at our situational update. Because one of the things, oops, I'm sorry, wrong tab, that we are starting to share with people is percent positivity. Anything over 5% positivity, and there is an indication that there is community spread. And so this is what you'll see on Facebook and social media. It's the exact same presentation. And percent positivity, sorry for the motion sickness here. I'm gonna go down just a little while. is now in this weekly hospital COVID update. So this is something we're getting from our HERC coordinator, which is the Healthcare Emergency Readiness Coordinator, and she is over a multi-county area. And I think that this is important to look at. So percent positivity, we talked about that 16%, so it's gone up more recently, but in 14-day rate, we were down at 15%, just under the state average. So with this page, it shares with you in a more public way what I know and what I'm seeing in a private way in the data that I have access to, that our hospitals are overwhelmed. We have had 2 out of the 8 deaths that we have been notified out of La Crosse, hospitals in La Crosse, because they physically did not have beds here in the Chippewa Valley. I do see that hospitals are on and off divert, meaning they're not taking anybody, and have been for the last 2-3 weeks. And we're starting to see that same trend in the Twin City Metro and in Minnesota. And so that's significantly concerning. Recognizing that they may not have room to do a surgery to set a broken pelvis, and they may not have room to take care of some of the more regular hospital needs, because they are full with COVID-related illnesses, as well as a reduction in staffing associated with many of their staff members throughout our health system partners being much like our larger community and having COVID isolation requirements or quarantine, meaning that they've been exposed to somebody who is COVID positive. And so I think that this is a main takeaway for you, that our healthcare system partners are extremely stressed. Many of them in our Eau Claire, Chippewa Valley region are into their surge capacity, meaning they have activated MOUs with other entities to increase their bed space and gotten really creative with staffing, many reaching into other parts of their enterprise to bring in staffing to support our Chippewa Valley. The other thing that I wanted you to see, and close your eyes for a second, it's going to get a little fuzzy, is that this risk factor with our activity rate, it's all red. And so you've heard me talk about being at very high or high, and now nearly the entire state is at critically high. So the state has actually increased its activity rate metrics to be one step above. And you'll remember that the Harvard Global Public Health metric expected that a community our size would be overwhelmed with more than 12 cases a day for 1 week. And right now we're averaging about 62 cases a day. So to say that we're overwhelmed is an understatement. And you can see that happening throughout the state right now. The whole state's public health system is overwhelmed. And in many of our regions, our hospital systems are also overwhelmed. So I wanted to share that bit of data. And then there are other things that you guys need to have awareness of. Because we're so overwhelmed, we've really had to reimagine how we do our contact tracing. And so last month I shared with you that we were still doing extensive contact tracing, but that we had started leaning into the state to take some of our cases. So even with the case support from the state, we have actually had to modify that again to where we are having people that we cannot reach and the state cannot reach. And so we are working with Human Services and some of the staff up there to help notify people with a mailing that their positivity status, as well as things for next steps. Additionally, we are asking all of our non-household contacts, so if you're positive, we're asking them to personally identify close contacts for everybody outside of the home. So we do obviously we collect the data on the household contacts, but we ask them to use a national database, which is Tell Your Contacts. So it can be anonymous via text or via email if they're uncomfortable letting people know with a phone call or an interaction. And that is as a direct result of our stress and strain on the system, looking at about 6 times more cases than what a community our size should be able to handle without collapse. So I don't have a ton of good news in this situational report, but I think that it's important that you know the reality of what we're facing here. I am actively hiring. I've brought on 4 new contact tracers in the last week. That brings us up to 22 different people here in the health department. That's in addition to the 13 tracers that Stout has. You'll remember that we started this back in February with 4 public health nurses. So an incredible expansion of staff. So to say that COVID is consuming the health department, I think is an understatement. Any questions on any of this?
Supervisor Bjork.
I'm searching for good news, so I'm hoping to turn over a rock that maybe produces some. My question would be, the hospital stays, are we seeing the length of hospital stays change? I mean, is there been treatments that's been deemed effective that we've learned to shorten the hospital stay? And number 2, is there any outpatient treatment? And number 3, are all the hospitals, do they have the same criteria for when a person is released or not? Or is that a decision for each individual hospital?
So I'm not sure that I can speak to the release criteria for each individual hospital, but typically they want them to be medically stable and whether or not they're infectious. I would share that we do have more outpatient options in that some of our health systems have kind of a remote monitoring that they're doing. So they'll send people home with a pulse oximeter and other kind of remote Bluetooth enabled monitoring, which is pretty Star Trek if you think about it. And so I think that releases some of the strain on the healthcare system. The length of stay for COVID positive people that require hospitalization is long. And our healthcare systems are kind of backed up because many of our long-term care facilities and assisted livings are in outbreak, meaning they are not allowed by CMS to take new clients. And so that there's this really hard space between people that need more than being released home with external monitoring and hospital stays. And so there's a real backup there. And I think we are learning more about efficacy of treatments. I do know that we've had clients that we've been following that reported for injections and did not stay over, which is fantastic, or IV treatments rather. So the hospital systems are really trying to address this as nimbly as possible, but I don't know that I have the sunshine and rainbows that you're looking for.
Supervisor Bjork.
I can identify a sunshine rainbow because KT smiled when she was telling us about the Bluetooth, and I've missed her smile.
Chairman Bartlett.
With the people that you've hired for contact tracing, have you tapped into retired health people like nurses and stuff?
Yes, so that's been fantastic. We have an amazing network of retired nurses here in Dunn County. And I am grateful that many of them still have that dedication to the common good and the grace to know that when people are in a moment of overwhelmedness around COVID-19, that it's not personal. And so dealing with difficult folks having a challenge in their day, they've shown to really roll up their sleeves. And so of the 3 that I just hired, one is a retired hospice nurse, one is a retired hospitalist, and I think the other, I don't remember where the other one was a nurse, but 3 of them are retired nurses, and that's been really, really helpful.
Supervisor Cromery.
Thank you. Is there anything this group can do to help you, KT?
So thank you for that. I think the first thing is to stay home, and I know that it's a challenge, but to encourage your loved ones to keep themselves safe and to reduce their gatherings to just their household, especially as we're coming into Thanksgiving. I anticipate that we are going to have a significant spike related to small gatherings in homes and deer camp. So as much as you can, share within your trusted channels, your friends, your family, the reasons why you think it's important to keep people safe. Because we are seeing cases that really run the gambit, where we have mildly symptomatic people that think that it's just a sniffle, it's just allergies. And then it's not until day 3 or 4 that they have the kind of symptoms where the light bulb goes on and they recognize that it could be something else. And my real sincere concern is that someone's going to go to Thanksgiving with grandma and share that sniffle germ, which is actually a COVID germ, and then have to live with being responsible for sharing COVID to somebody that can't fight like they can fight. So that would be really helpful. I know as a board, we have to be really careful, and as a public servant, I have to be very careful to only educate, to not advocate or lobby, but do let your elected officials at the state and federal levels know that our community really could benefit from additional CARES funding. We are talking to more and more people that are on the margins, that are one meal away, one rent payment away from not being securely housed or securely fed. When we ask them to quarantine or isolate, we know that sometimes they physically can't and still feed their babies. We need additional support for our Dunn County residents to do the thing that they need to do, know they need to do to keep the rest of our Dunn County residents safe and healthy. And then practice gratitude. And I really hold on to that with 2 hands when things are really challenging, is that I try to really sit with what I'm grateful for. It is definitely helpful for my team when, like the little card that we got from the wonderful little person thanking us for our work, it brightens our day. And I try to extend that to whatever frontline worker I have the opportunity to be in contact with, be it in the grocery store or in the healthcare system or in public health. Thank you for the question.
Thank you. Other questions for KT? As always, you have our admiration for the work that you and all of your staff at the health department are doing. This is, it's sort of unbelievable. And the fact that you've stayed with this and done this so well is really a testament to your leadership at the health department. So really, thank you very much. Let me just quickly ask Greg if we need to interrupt KT for a minute for your report, or are you free at the moment? You had asked us to move your report earlier.
I can wait until KT concludes.
Okay, if that's all right, Greg.
Yep, absolutely.
Okay, great. KT, the next item is financial report. Do you have financial data for us or not?
So I apologize for not getting that into your packet. We were trying to really balance the staffing that needed to come out of levy or public health admin and put it appropriately into the communicable disease or CARES funding. And I know that Sarah, I punted to Sarah, I think just a couple minutes ago, and she said that she would present to you with the financials that she and her team put together for me earlier, I think the day before yesterday.
Perfect. Punting to Sarah.
I'll start to share my screen. Can everyone hear me? Okay. Just give me a second. I'm not very good at running this. So can you see the financials? Did I do it right? Or are you seeing something else? They're there? Okay. Because it looks like it's on the wrong side, but are they moving?
Yes.
Okay, good. All right. Sorry about that. KT noted that you guys did not get the financials. So how detailed would you like them to be? Would you like just the bottom line summary of where the health department is at, or would you like to look at the public health admin, the entire full financial?
Why don't we go with the highlights, Sarah?
Okay. All right.
Lest I hear objection from other members. Go ahead.
Okay. I'll just start with column D. This is the year to date, and I'm on the expense tab. So we're showing public health at $1,340,058.89 for expenses. For 2020, their budget was 1.9. For their revenues, I'll again go to the total revenue. Again, summary, unless somebody wants to hear something else. The grand total right now is $1,186,619. The difference of the two year to date is $153,439, a shortfall, but this also reflects probably about a 2-month delay in CARS revenue. So there's still 2 months between the expenses and the revenue. We have 2 more months of expenses than we do revenue brought into the department. I know it's quick, but does anybody have any questions?
Supervisor Steen.
Yeah, Sarah, on the sheet that I got in the packet, if I'm reading it right, it shows us with about a projected $230,481. Is that what you think we're going to bring forward, or did you just change it to 100 and whatever?
That's for human services. This is public health financials.
Okay, yeah. Excuse me for being so dumb.
No, that's okay. No, it was quick. I'll present that in a little bit.
Yeah, okay, then I'll get you.
Okay.
I have a question on, can you give us a ballpark figure, KT or Sarah, about the COVID-related expenses that you think we're going to get reimbursed for, or hopefully get reimbursed for? And how much of a over levy amount is that?
So, I don't have that number. Sorry, KT.
So I know that Sarah works with Precision. I'm going to give you a ballpark. So we were awarded about $500,000 worth of CARES dollars So federal pass-through and state funding for communicable disease follow-up. Much of that is offsetting some of our levy needs, but I do have to disclose that our program generated income in reproductive health specifically is abysmal, because obviously with our clinic closed the way it is and people staying home the way they are, we're not seeing as many people, clients, in for reproductive health services. So there will be some impact to that. But my intention is to not leave any of those dollars on the table, especially with this round of hiring to meet our surge needs. But then also work very hard to not overspend the CARES funding with contact tracing and disease management, but to try to ride that line.
Thank you, Katie. An additional question I have is, I assume, the way I understand it, that we can't recoup lost revenue. All we can do is recoup money we spend on the COVID. Is that correct?
That is correct.
That is my understanding.
Okay, other questions on finances, health department finances for either KT or Sarah? If not, thank you, Sarah.
You're welcome.
And KT, then the Colfax MOU, which is something that KT and I had discussed as it was occurring, but we wanted to make sure that this was brought to the attention of the committee. And you have this in your packet.
So for your awareness, we were approached by the director of Colfax Rescue to say, we see the need, we believe that we can support you in that need. After their responsibilities to the village of Colfax are addressed and they're not on any kind of EMS run, they have volunteered at no charge to the health department to do some contact tracing. And this is a trial. We have integrated the director into our regular half-hour meetings. And he is paired with a mentor to start the training process. And we're hopeful that he can start some contact tracing and then train his deputies so that, again, instead of being paid by the village to wait for their next call, doing whatever, they can wait for their next call by doing some contact tracing. And if that works, we may seek to replicate that with some of our other medically oriented organizations within the county.
Yeah, I think that's just great, and I compliment both you and the Colfax EMT for doing this. It helps, I'm sure.
And it was the director, and the gratitude really should go to Don Knutson and his initiative to really seek to make Dunn County safer.
Anything else, KT, or any other questions from committee members for the health department?
I did want to clarify, in your packet, it seems like forever ago, but the community health needs assessment in its final iteration is in your packet. So that is the culmination of literally 2 years worth of work where we did a survey, worked with community partners, and then put that together to create Health Done Right out of the community identified health priorities. I really look forward to getting back to that important public health work. Much of it is on hold, but the action teams of Health Done Right have picked up the mantle and have started working remotely to address some of those community identified needs. We will send out bound hard copies to our community partners that help participate in the data collection, and we will post that online tomorrow.
Great.
And I would just clarify that those did not actually go out in the packet. Those went out in a separate email. So if you're looking through your packet for them, they came, my highlights, the community health needs assessment came out in a separate email on Monday or Tuesday.
Yeah, Monday.
It is 60 some pages. So if you're looking for a paper copy, do let me know instead of running through all of your ink.
Yes, and another wonderful piece of work that's ongoing, even in the face of the pandemic. So that's great. I'm on the housing action team when I am able to make the meetings, and it's really good work in the community. Anything else? And Chris, just let the record show that Sarah Schaefer has joined in. Welcome, Sarah. Thanks for being here. So moving without objection to Veterans Services, Greg.
Good evening, everyone. I will start my report off. If we just start with the narrative piece, which I'm talking about some things that we're doing locally within the Veterans Service Office. You can see that we have hired or partnered in the hiring for a grant worker through UW Extension grant, an innovation grant that we had received. Mr. John Weaver, who interestingly enough is still on active duty, but he's doing a program that's called Green to Gold. So he's an enlisted soldier that is getting his education and becoming commissioned as a lieutenant. It's roughly estimated about 15 hours a week over a year, although we have a little bit more flexibility than that. UW Extension is the pay source. We're just providing in-kind. I'm providing the supervision and really kind of guiding the intent of the program, which is three-phased approach. First phase is to gather information from dependents and veterans and stakeholders on truly what they hope to learn about the culture and working with the population, as well as things for veterans, dependents that they would want the other stakeholders to know in working with them. And then kind of moving to phase two, which will be delivering more kind of some presentation, some education with some of the partners. And it's a three counties, Pepin, Buffalo, Dunn County. I'll keep giving some more updates regarding this. We've just kind of got it started, but we've been working on surveys and stuff. And I kind of running concurrently with that. We're really hoping to start a mentoring program. You can call it what you want. There's terms you hear about, battle buddy programs, a 9-line, which is just some military terms, basically looking out for your battle buddies. And if we can start to develop that. And so Mr. Weaver's pretty excited about trying to work on a mentor program as well. So we can, even if it's as simple as some phone calls out to some veterans that are in need, maybe need a little lift in their life. Nothing significant to report regarding state or federal benefits. Financially, the same. We're on track. A couple of months ago, I reported we're probably going to have I'd say a couple $1,000s that will go back. That will be unspent, and that's a training related, because everything now is virtual. So there's some savings there, which I want to emphasize, because in light of all of the COVID related stuff, that's an upside when it comes to budget. And related to COVID-19, emergency preparedness related, we're still meeting face-to-face with veterans, of course, following all the procedure and protocol. And I think that it's still going well. People don't have any issues with following the PPE guidelines. So that's continuing. Medical equipment, there'll never be a drop off in that. And, just today, probably half a dozen pieces of equipment going out, but actually took in more. Had a nice donation of items. Unfortunately, individuals' loved one had passed away, but they had a lot of items that I'll be able to work with some local home care agencies, maybe even include. I talked to one of their employees to get that, because some items we won't use. Still working fully staffed, although with the closing of the school, when it's staffed, that might change things a little bit with doing some virtual work, but it's all up in the air based upon what's happening within the school districts. Any questions about the information I just put out
Any
Okay.
questions for Greg?
Like to then move into our veteran service, our veteran served report. Again, I always like to throw in a couple of impact statements out there, so you know the personal touch, things that are happening for the citizens, constituents out in Dunn County. The first item, and you talk about, from my perspective, really next level assistance and attention to detail to ensure that a benefit is not lost. You know, within definitions, there's definitions for relationships, for marriage, so on and so forth. And so we had a situation that we really pursued heavily regarding a common law marriage. Wisconsin doesn't recognize that. However, had a couple. Unfortunately, the veteran was suffering from severe post-traumatic stress, documented with combat awards. One of the items that was listed in his in some of his mental health treatment was excessive speeds and that rush and that feeling. Unfortunately, he had passed away doing that very thing. But left behind the mother of his child, who they'd lived together forever, relationship, so on and so forth. But it took over 3 years for us to finally get the VA to recognize that the significance of that relationship. And so that surviving significant other is going to receive benefits for the rest of her life, and that dependent will be cared for. And honestly, like it was like about $30-some thousand that came. So there was some tears shed over that, just because that, it's not our choice on the definition of a relationship. It's how that couple or that family defines that. And if they're in our county and they say, go help us, it's our responsibility. And so that's a positive outcome and really a game changer for that family. The child is very young, so that significance will be, I think, realized much later. And the other one is just to emphasize crisis, and I know there's others that are on tonight that deal with crisis, and it's exacerbated quite a bit right now, and so assisting somebody and partnering with the right people to go from the point of crisis to the actual point of I'll call it calm or support, where they can take a deep breath and know that they've got all the stuff around them. So within, I think in my report, within 2 hours of receiving the call from an intoxicated veteran saying, hey, it's time, I'm done. But he called because he didn't want it to be done. And working with Chris's staff in human services, Dynamite, call crisis workers, say, hey, here's what I got going on. Here's what I think. She said, yep, do this, and advised me wisely to contact Mayo ahead of time. Say, hey, gentlemen's gonna be coming there, hitting the emergency room. Their social workers are there coordinating. So there wasn't gonna be panic when somebody shows up in the emergency room intoxicated, saying that I want to harm myself. And then all of the coordination with the VA to let them know. They panicked a bit because they don't want anything bad to happen, but once they talked to me, realized that, oh, we got it. We're just letting you know that he's going to be coming to you for aftercare. So again, positive outcome up to this point. Voluntary 72-hour hold. Things are going better. He talked to me afterwards, got ongoing counseling and support set up. So those are, to humanize what we do. Thought I'd always add some of those impacts and the coordination that happens. And, from the services out in the community to us within this public sector. So any questions about that? Otherwise, that'll conclude my brief tonight.
Great.
Yes.
Am I on?
Yes, Supervisor Bjork, go ahead, please.
I don't know what, I can't remember what the tradition has been in the past, but I do think with this year with the COVID and, there wasn't much activity for Veterans Day or anything like that. I might be wrong, but I mean, I thought in the past that we recognized our county board veterans or even spouses of county board members as, at our county board meeting. And I guess in the future, I would certainly think it would be appropriate to at least list our veterans and their branch of service and maybe their years of service. Any comment on that?
Full support. That's a great thing. And it was I think I was briefing at the county board just the day before, if I got my dates right. And it was a quick mention, but Larry, you're absolutely right. Because the county, from the seat I sit in, the county has done a good job with hiring veterans. There's quite a few that work for the county. So that's a good point. I can take that up the chain to make sure it happens.
Well, I guess what I was talking about more than anything is that the actual county board members, the members of the board that are veterans, I think we should list, if they don't have any objections, list their names. I mean, I sat down and visited with somebody one time, and he was telling me about his Navy experience, and I was just blown away. And I never expected what I heard. Thank you.
Sorry, I muted myself. Anything else for Greg? Good report, really good work. Those two cases were really quite amazing to read about, I think, for all of us. So thank you. Okay, moving on. Department of Human Services staff report. Turning it to Chris.
All right. Well, once again, you have written highlights for November in your packet, or that came out in the email. Please do take the time to read them because they do reflect some relatively significant moves and changes that are happening in various funding and programming. But I did want to draw your attention to the fact that on the right-hand side of those November highlights in red, it tells you that on the day after our last board meeting, in which we passed a kind of end of the year conclusion budget adjustment, we received notice of receipt of a $270,000 grant. And so Sarah and the finance crew worked together to include that in the budget adjustment that went forward then through the executive and county board for November, but it missed this committee by a day. So we just wanted to make sure that you were aware that that had happened. It was for it's called the State Opioid Response. And it's money that they send to us that we pass through to Arbor Place for treatment resources. So, and then the other thing that I wanted to say was, this was just to piggyback on something that KT said earlier, and then Diane's involvement with the housing work group for the Community Health Coalition, but the housing market is really, really tough. And the people that have been involved in it for a long time, like Heidi Hooten from Stepping Stones and Jamie Gibson from the Bridge to Hope, said they have not ever seen it like it is right now. And that they literally sometimes have no resource for someone. They cannot find them a place to be. And so, again, kind of circling back to that, what we can do, anything that you can do to advocate for whatever powers that be, from local on up all the way through to really take a firm look at housing and housing insecurity and food insecurity. We have a hurting community. We have a hurting state. But we have a hurting community. And then, absent any questions about the written report, I am not going to take up any more of your time. I'll pause for just a second in case there's any questions. All right, then I'm going to introduce you to Lori Radcliffe. Last month you met Carrie Anderson, who is a Family and Children's Services Manager, and Lori is her counterpart as a Family and Children's Services Manager as well. Originally, they were kind of hired, one to work with more of the child welfare side of things and one with more of the youth justice side of things. They are, I told someone today, sort of joined at the hip. They also are very, very good friends, so that helps a lot. But they are kind of joined at the hip, and they're kind of interchangeable as it comes to their staff and who staff will go to, or I mean, if they need something, they can rely on either of them. So Lori's going to spend some time doing a presentation for you on our continued efforts to bring some awareness about the various programs. She's going to do a presentation on child welfare programming in our county.
Hi, thanks for having me. I wanted to say, KT, I appreciated your hearing your presentation, and for once, our presentation won't be the grim and the hard one to hear. So there is some light in that. It's like, oh, we're not the one that, you know, takes people's kids away. So it's a little uplifting to know that I appreciate all the hard work that you're doing and your department. So thank you. So I put together a presentation, and I think for some of you, this might be some of a repeat, and yet it kind of goes through just an overview of what we do. And then towards the end, I'll get through some of the outcomes and impacts of COVID. So as you see, so like Chris said, Carrie and I partner our management. And so she does youth justice, but we're interchangeable. And so what I'm going to present on is the child protection side. And as you see, so we have 10 staff in the child protection side, which includes an access worker who takes in the phone calls, 3 initial assessment workers who go out into the field to do the first assessment. And then we have 3 ongoing child protection workers. And then we have 1 new worker who's in training. So we haven't really assigned what she's fully doing. She's doing a little bit of both right now. And so I didn't really put a full name to her yet as far as what her full-time duties will be. And then I also have 1 social service aide. So typically when people say, you know, child protection, what does that mean? We get the phone calls from the community or mandated reporters related to child abuse and neglect. And when a county we receive the child abuse and neglect report, and that comes to the access worker, who's Katerina. She takes all the calls. She's a full-time access worker. And so typically she'll take the phone call, which can last anywhere from 20 minutes to an hour and a half. She puts together the report, and then it goes to either Carrie or I for screening. If the report meets the definitions for a potential abuse, we then launch an initial assessment. There's 3 different categories for the initial assessment. There can be immediate response, where we need to respond immediately. A lot of times those we go out with law enforcement, either they're out in the field and they need our assistance, or we're getting a call at a school where a child may have a severe injury that we need to respond to before the child goes home. And then the other response time is 24 to 48 hours or 5 days. And so that's when the initial assessment is happening. That's the start of it. The initial assessment worker then has 60 days to complete an assessment, and it must be conducted in accordance with the Wisconsin Access and Initial Assessment Standards. I think oftentimes we can get phone calls where people are just kind of worried about kids or kind of worried about their welfare. The work that we do is really driven by the safety intervention standards, and we have to be very cautious and do a really thorough job in screening so that we aren't intervening in situations that we don't have the legal authority to be involved in. So that's why sometimes I think people can get frustrated if they don't really know that what we do is guided by the standards and it's not a decision based on just what we think we should do. The focus of the CPS initial assessment is child safety. Again, that's defined by the standards. And the goal is for the workers to help get the family the services and to keep the child safely in the home. If the child cannot remain in the home, and we first will look for family members that either can come into the home or to kind of put together a plan, like a protective plan, or at times we look to family members who reside in the same community. Sometimes we go across the state if it's a family member where that child can be better served. Sometimes we do go and have a children a couple hours away. It makes it really tough, but again, the state really wants us to be looking at family members for placements and supporting the families first versus having kids go into foster care. At times we do put kids into foster care. As we all know, we've had some high numbers in the past, but we try to use that as a last resort. So the type of things that we are assessing in the initial assessment is physical abuse, which includes lacerations, fractured bones, burns, internal injuries, severe and frequent bruising, or great bodily harm. Sexual abuse, kind of go through all that. I mean, I would say this year or 2020, it seems like in our work we have trends as to what we're really getting a lot of. 2020 has been a year of a lot of sexual abuse cases. Not sure why that is, but it was the bulk of our work for at least most of the months. I mean, recently it's been a little bit quieter, but it was a lot of work. It was in pretty horrific cases, a lot of parental sexual abuse. And those take a toll on the families. They take a toll on the families. They take a toll on the kids. It takes a toll on the workers, the judges, everybody that has to hear those details because it's super difficult. Another form of abuse that we often, not abuse, but another reason for initial assessment to assess for safety is neglect. And neglect is the failure, refusal, or inability on the part of a parent to meet those needs for reasons other than poverty. Neglect that's typically something that we deal with pretty constantly. And this is where I think when we talk about our meth cases, this is where this lands, is because when parents are using meth, it typically equals that they're neglecting their children. And they're not meeting their needs. And as you see, they can, it's the refusal, but it has to also seriously endanger the physical health of the child. And what we know now with meth use, significant drug use, it does seriously impact it. And sometimes we don't even know that in the initial 60 days. We find out sometimes what's happened in the household years later of kids that were in these environments. And so it's one of those things that we are paying a lot of attention to. It's something we deal a lot with. I think this is one of the areas that decreased in 2020 only because we didn't have a lot of mandated reports coming in because of the schools being shut down. So it's something that is, the numbers are there again with neglect concerns for families. And then also like dirty houses come into this area too. And then lastly, the manufacturing of meth. This isn't something that in Dunn County we see a lot of anymore. It's not that it's not happening, it's just not something that usually gets reported to us. I think a lot of times when people are using drugs, they're accessing those drugs outside of manufacturing it themselves. Okay, and then lastly, emotional abuse. Really, it's when the parents are failing to meet the needs of the kids, and then the children have severe disturbances, anxiety, depression, withdrawal, outward aggression, outward aggressive behavior, and there's a change in a kid. So sometimes kids can, parents often yell at their kids, whatever, but it reaches a higher level and often over a period of time where it's documented this is continuing to happen and it's impacting the kid's mental health. There are cases that are super hard to prove unless you've really done a good job at having the documents from schools and from our work and an assessment, and the kids kind of being able and willing at that point to report what's been going on in their household. And then lastly, unborn child abuse. So this is one of those unique situations where we'll get reports from medical professionals or mandated reporters or even individuals, but this is related to when a mother is using drugs or alcohol, and it's just, whether or not it impacts the child. A lot of data kind of goes back and forth as to what that means. So oftentimes when we get unborn child abuse, this is a scenario that we will often offer services without feeling like it's an initial assessment. We want to offer these women help, and we offer them assistance so that they continue to receive services from mandated reporters. Because the drug use or alcohol use has to be out of control. It can't just be a mom drinks, or it has to be habitual and out of control. This comes into play a lot of times with our repeat clients where they've had children, whether or not the children were removed, potentially terminated, and now they're pregnant again. That's a lot of times, this is when we get these parents that come back to us frequently. So then after the 60 days of the initial assessment, the worker needs to decide whether or not this family needs ongoing services to provide safety for that child. So that's when it moves into ongoing child protection, where the worker has decided they need ongoing services to keep the kids safe and ongoing monitoring. They petition the court. And then if the child remains out of the home, sometimes we can have a family for 2-3 years. If the child's in the home doing well, we typically have it for about a year, and then it closes if they continue to do well. The CPS ongoing focuses on child safety and continuing to engage with families to keep the children in their home whenever possible. And that does happen a lot. I think sometimes we don't hear or talk about all the successes that we have and the changes that people make, because those get lost in all the hard cases that have different outcomes, which leads us to the next slide. This goes back to our access reports. So this year we've had, and I think this has probably changed as of today, but we've had 543 access reports. And if you look at the past years, 2019, we had 744. In 2018, we had 850. So it's interesting because we'll see how this year ends. Because in the first few months of COVID, it was quiet. We were getting maybe a couple reports a week only. Once the kids returned to school, you can about imagine, we are getting about 8 to 10 reports a week, or a day, I'm sorry. And, with schools closing down or looking very different, I think that the report numbers will quiet down a little bit. And I guess we'll see what happens, but that is a huge impact for kids with COVID, with them not being in school and not having mandated reporter eyes on them. Some of the numbers for this year that we've seen, last year, because it's been a couple of years since I've come to present, 2019, we did 14 termination of parental rights. And those were all related to meth, the use of meth in the parents. That's a huge number for a county our size. It's a sad number that, you know, parents are struggling with meth use, their mental health. 2020, we've had 8, 6 meth related. In the next couple weeks, we'll have 2 additional terminations. So at the end of the year, we'll have a total of 10 terminations. 8 of those cases are meth related again. And I think those numbers change over time. If you looked at the Axis reports, how 2018 was a higher year, or no, wait, was it last year? I'm sorry, let me look. Yeah, 2018 was a higher year, which makes sense why last year we had more terminations than even this year. So because it does depend on the number of Axis reports that come in. We have, at the present time, we have 24 kids in foster homes, 2 group home kids, 1 is supervised independent living, relative placements unlicensed 2, court ordered kinship care 12, and voluntary kinship kids at 42. To have only 24 foster kids at this time is I think 2 years ago we were at, I think maybe 50. So our staff has done phenomenal work at getting kids permanency or returning those kids home. So when I talk about the terminations, it's not the only thing they're doing. Kids are returning home and they're being supported in their home. So that's a huge number. That's a huge change from the previous years. Some of the other things that just to talk about how we're addressing some of the terminations and the concerns related to the meth use. Last year, we established Family Treatment Court. Family Treatment Court serves voluntary participants who have an open child in need of protection and services case where alcohol and drug use is the identified problem. These are typically participants who are voluntary, but have also, they're pretty high risk, and a lot of them have been in our system before and they've re-entered. The goal is to keep the children safely in the home while participants received increased accountability with drug testing, with court time, with contact with the foster or family treatment court coordinator, intensive case management. Again, the ultimate goal is to keep the kids in the home or to work towards reunification. So we started in August. We've had 2 successful graduates. I think we'll have another one here in the next few months. And I think that's a huge success considering that we've launched this and are keeping it going through COVID. And so that's been difficult, even as a professional, but our participants are attending over Zoom. And that's a great thing. I think, I'm hoping that we can continue to support that, but also I look forward to the day where we can be back in person with them to provide other support and personal contact with them. COVID impacts. Oh, staff are working remotely, primarily, usually at home. They do come into the office when necessary, but family and children's staff, we're essentially a first line to kids safety. And so we're still in the field addressing child safety, being called out by law enforcement. We have to see the kids in out of home care every month. So we have to kind of balance keeping COVID protocols and knowing that these kids are safe, whether the kids are in out of home care and especially when they're in their home, when they're more at risk. And so it's a constant conversation, and it's definitely more increased contact. So it may not be in-person contact, but it's in over Zoom, texting, phone calls, just ensuring that we're available to our families to make sure we can help support them, because mental health, the impacts for the families that we're serving, I mean, people are struggling. People are really struggling. And so just trying to be creative with how we can help serve families who who need additional resources, whether it's therapy or, whatever it might be for their kids. But so, yeah, people are struggling. I think it's just, it's a sad time, but yet we're working hard. I think our staff is doing a great job at meeting the needs. The court hearings have continued. I want to commend our court system for doing that. A lot of local agencies haven't continued with their TPR trials or their hearings. And our court and our district attorney's office has allowed for us to continue with some of the termination hearings or trials, which has led to kids getting permanency. I think that's a big deal so kids aren't waiting for an additional 9 to 10 months to figure out what their plan is. I always say for us, a month feels like, but a month for a kid can feel like a year. We have to remember that these are kids that deserve to have their outcomes achieved, and to never lose sight of that, no matter what else is going on in our community. So I think that's kind of it. I open it to any questions that you may have.
Excellent report and excellent work. Questions for Lori? I'd like to say keep up the good work, but hopefully these events would not have to happen, but that's, yeah, whatever. No questions for Lori? Okay, again, thank you. That was a great report. I appreciate it.
Thank you.
And I think Sarah's going to do a financial report.
Good evening, everyone, again.
Thanks, Sarah.
You should have gotten your financial summary report in the board packet, emailed out to you or mailed. I'll go right to the projected column, which is column F. So we show our budgeted expense projected at $14,005,148. That breaks down to our operating being $8,998,322. And our salary is $5,006,826. Our budgeted revenue projection comes to $10,138,921. And our county levy use we show with our projections that we'll need $3,866,227. And that shows that we should projectedly give back $230,481. Are there any questions?
Supervisor Steen.
Thank you, Sarah.
You're welcome.
Any other questions? Thank you. Another good report.
Thank you.
We have an action item reviewing no review of budget items. I will need a motion to review the vouchers paid for the month.
I so move.
Supervisor Steen moves. Is there a second?
Second.
Mr. Lamb, second. Any discussion, questions? If not, all in favor of noting review of the October vouchers paid signify by saying aye.
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 All right. Vouchers are, we've noted review of the vouchers paid. Anything else from committee members? Supervisor Steen?
Yes, I'd just like to take this opportunity to thank everybody for their work and to please enjoy your families and your holiday coming up. This COVID thing is a once in a century thing, and we should really appreciate our families and try to do the right thing as we go forward. Please stay healthy.
Nicely said, thank you. I do have something to share. Some of you may know this, but Chris Corpola last Thursday or Friday posted on Facebook this very nice appeal. given the issues that she's raised with housing, noting that Stepping Stones will not be able to operate its shelter this winter, and that one of the alternatives will be hotel stays for clients who have no other alternatives. And so far, she has raised over $15,000, and she keeps raising the ante, and people keep stepping up to do it. And it was extremely well done. It was really wonderful, and you've made a huge difference. And we really appreciate you. You are great.
Thank you. It was, Facebook makes it super easy. Facebook fundraisers don't charge any administrative fees to a nonprofit. The money goes directly to Stepping Stones, but it was a request for people to share the information, and that they did. And I would say 3/4 of the donators are people that I don't even know. So the word has certainly gotten out there, and it's been super cool.
Well, it's super cool and well done. The last time I checked, it was like 15.5, something like that. The goal now is 20. So if anybody wants to log in and contribute $70 or anything else, feel free. I echo what Supervisor Steen said. Stay safe. Happy holidays to all of you. Keep the December 17th meeting date open, and we will let you know if there is business to be transacted at the December meeting. Anything else? Without objection, colleagues, we are adjourned.
Stay safe.
Thank
everybody.
Thank you, everyone.
Thank you.
Very much.